Intelligence tests that are individually administered by a psychologist in person are still the gold standard for measuring intelligence. Those tests are the best choice for high-stakes decisions which have long-term or irreversible consequences. The Riot is not meant to replace those tests, but rather to serve as an option for medium or low-stakes situations. These are decisions that are either reversible or do not have long-lasting consequences. For example, a counselor may use the Riot as part of a series of psychological tests to determine which type of therapy might be most appropriate. That is a decision that can be changed later on. However, the Riot is not appropriate for diagnosing a person with a mental health disorder because that is an important long-term consequence for the test taker. The Riot does not replace face-to-face testing for important situations, but is an option for clinicians, employers, researchers, or people who are just curious about IQ.